Aloha and good morning. It is Wednesday, June 24th, here on the COVID-19 Care Conversation. I'm Ryan Kalei-Suji, joined by Yunji Denise. And today, once again, we will be diving into more things related, of course, to the state's response to the COVID-19 pandemic and how it has affected the healthcare industry in so many different sectors. We'll be speaking, Yunji, to a very special guest that we have coming up.
Yeah, we're so lucky to have Dr. Angela Pratt joining us from Kapiolani Medical Center this morning. She is the chair of the department over there at the Hospital for Women and Children. She's also the president-elect of the Hawaii Medical Association. So she wears two hats, representing not only herself, but her colleagues, and then also talking specifically about women's health. So we're very excited to have her on here. We've heard many stories from different cities about limitations when it comes to how many people can be in the delivery room and what it's been like for a lot of women to deliver babies in this time. And also, what are the challenges for prenatal care, for postpartum care, for family care? We're going to talk about all of it, so we're excited to have her on. Of course, we start every day with the count, and thankfully, Ryan, single digits again yesterday.
That's right. We saw 4 cases reported on Monday, 3 cases that were reported on Tuesday. The total now stands at 819 positive cases of COVID-19 in the state since the outbreak began. This has been sort of a up and down past few weeks. We've seen those numbers spike as high as up to 22. Now, again, 3 cases yesterday. And again, a lot of it goes to the state's response to opening up a lot of various businesses and different things being allowed. Once again, they did say that they were expected to see this surge, and certainly we saw that, and those numbers continue to remain low. We'll see where those numbers lie again today. As we continue to see more headlines come out about the future of Hawaii and its reopening efforts, we know that the governor is planning on having a press conference at 2 p.m. this afternoon. We did hear from him earlier this week say that in a few days he would make the announcement about opening up Hawaii to travel beyond just the neighbor islands. And so we will see if that announcement is in fact what we hear from the governor this afternoon.
Yeah, the governor is facing a lot of pressure, both internally and now outside of the state, to reopen Hawaii. The big headline yesterday, news alert went out last night, and it's the cover of the paper today. The feds want the quarantine lifted here in Hawaii. The Department of Justice has they're added their sort of voice to a case that's ongoing. This is a group of Kauai and Hawaii Island residents who are actually suing the state of Hawaii to try to get the quarantine lifted, saying that it's unconstitutional. So the Department of Justice submitting their sort of position, if you will, in support of that lawsuit, saying that they agree that this is perhaps not allowed under the Constitution. So we'll see if the governor has anything to say about that. But turning now back to our guest, we want to talk about how people are living with COVID and how people are navigating healthcare in this time. We want to welcome Dr. Angela Pratt from Kapiolani Medical Center. Thank you so much for being here. Full disclosure, Dr. Pratt delivered both of my children, so I'm a little biased toward our guest. And we're so happy to have you on this morning. So tell us, we've seen these numbers go up and down from the start of the pandemic to now. How has it changed when it comes to actually delivering babies at the hospital?
It has changed dramatically just because we're trying to be safe. And Hawaii has done an excellent job at, flattening the curve. But we do have a pandemic, and it has changed the way we look at healthcare and how we manage. So at the hospital, they've implemented, just basic procedures like, checking temperatures when we arrive, asking questions. But in general, we've tried to make it the most natural experience as possible, trying to keep it as normal as we can. But we've had to change a few things, and those changes have been difficult for women to navigate.
Certainly one of the most enjoyable moments of welcoming in a child to a family is the opportunity to show off your child in the rooms and being able to welcome guests to the hospital. Obviously, those things were not allowed. Can you sort of talk through the process into what sort of was implemented and what currently the status is right now in terms of allowing guests in and really exposing maybe the baby and the family to those who maybe want to visit those in the hospital?
Well, I think that the biggest factor has been having a patient or mom deliver with or without her partner. That has seemed to be the biggest concern. And as you are aware, and many of your viewers are aware, they were in certain cities not allowing laboring moms to have their partners at the bedside. It was only healthcare personnel. So at Kapiolani, you are allowed to have 2 visitors at the hospital, but only 1 person at a time, and that's to protect the patient, the staff, and the newborn baby. So we've implemented that. The hospitals practice multidisciplinary drills to make sure that we are treating our patients well. When we do have an emergency, we use protective equipment. But, we're also trying to keep mom and baby together as much as possible. So we are doing in-room, it's basically keeping moms with their babies. So rooming in with the babies. And then we've closed our nursery to visitors, and babies stay with their moms the entire time. And we're not putting them in the nursery unless there's a medical problem that mandates that. So we're trying to keep them together as much as possible.
Let's talk about the prenatal care side of this. We know that if you've ever had a baby, you see the doctor a lot, especially toward as you get closer and closer to your delivery day. We've talked to a number of doctors from Hawaii Pacific Health about how some of their patients have delayed their visits. Maybe they put off, a wellness check or what have you. How have you seen that in the patient population that you serve with women who are pregnant? Right.
So pregnancy is particularly is very difficult to be done in a telehealth way. So we've implemented that. We do encourage them to reach out to me and to reach out to my staff, and we're talking over the phone a lot more. We're doing some televisits, but we're also encouraging them to keep their appointments. So we've had to do things like, temperature checks, visitor questions. We've arranged the office so that there's social distancing. The check-in process is much more streamlined. They come in, they go directly to their room. And I've tried to do creative things like having them have their own disposable stethoscope. I try to do fetal adoptones and encourage them to purchase their own, and we've helped them to do that. So they have personal equipment so that they can use that's their own, and we're not sharing. That's been a challenge. I know it's a little more expensive, but I think everybody feels better about that. And then we're also, I try to do bedside ultrasounds at every visit because I feel like mom and baby are connected better, and that's part of the anxiety that goes along with navigating the birth process and being pregnant and worrying about if you're exposed. And so trying to have mom be more engaged in her pregnancy and trying to talk about the realities of stress and how that can impact the pregnancy. And there's only so many things that you can control. So I ask them to limit their exposure to the media somewhat, that they're in control of their thinking, try to get some sleep, try to recognize that now is a good time to bond with your family, to be at home, to return back to family values. And all of those, I think, are helping them navigate the pregnancy itself and also to navigate postpartum. But we are encouraging them to keep their appointments and to make sure that they see us for their regular checkups. And especially if they have comorbidities, they have a high-risk pregnancy, that they're coming in like they should and not be afraid to come in, to go to all of their visits that we're asking of them. In the realm of general OB-GYN or general preventative health, encourage them to get their mammograms, to seek the care that they need, and to not be afraid to do that. And if something doesn't feel right, to reach out, because there are obstetrical and gynecologic emergencies that are still happening despite the pandemic. That could be severely catastrophic for someone. It could impact their health, like ectopic pregnancies, ovarian cysts. These are all surgeries that needed to proceed despite the fact that the operating rooms have been limited.
Beyond just, giving birth and obviously being in the hospital for those few days after, and then taking, the baby home and trying to be a part of just raising the child in those first few days, weeks, even month after pregnancy. I got to imagine for some of these moms, it's a pretty stressful time. I mean, not only are you welcoming in a newborn, but if you have other kids in the house and everyone's sort of confined to these settings, it can make for some stressful situations. What advice are you giving to mothers, maybe throughout this whole process of not just the delivery, but beyond, and trying to manage everything that's happening around while welcoming in a newborn?
Right. Well, I think having a child and bringing in a newborn, I mean, we're navigating our other children. And I think that's what moms all struggle with, is that they have a newborn, but they also have other children and other responsibilities. Some of them are taking care of kupuna. We have multi-generations staying in our home. So, trying to help them navigate and being specific about who's going to care for the child, who's going to do the internet on learning, and just having a plan. And then I tell them, try to decide what task you want to try to complete that day, or how can you in your work day or in your daily routine figure out a way that you're more organized in your thought, and then also making sure that you have some me time. So sharing responsibilities and making sure that partners are engaged. And then some of them, still work. They have partners that work. And so trying to understand that we all are trying to make it less stressful. And like I said, decreasing anxiety, I think it has to do a lot with planning. And I reassure them that I'm as close as the phone, and that they can reach out at any time. I'm always, and try to always be as accessible as possible, because I think if you have that, then you feel like you can, at any point, you can, get a hold of your doctor. So either if your physician practices telemedicine, or they're in a group, or however it is that they manage, that they have a lifeline. And I think that has served them well and has worked well for my patients.
What do we know? I know that COVID is the kind of thing, that this disease we're just learning as it goes, but do we know anything about how this disease particularly affects women who are pregnant? If you are pregnant and you happen to be exposed to COVID, are there risks to the fetus? What do we know about that right now?
There are a lot of studies on that, and we've learned a lot. At first, we really didn't think that there was any vertical transmission, meaning that if a COVID positive mom gets infected, does it go to her fetus? We really didn't think that was the case. And what we learned from Wuhan was that we really didn't think that was happening. That we really felt that a baby's exposure and a risk to COVID was at the time of birth, and that it was the close, fetus, newborn to mother that caused it. We're not really sure that, studies are ongoing. We don't think that there's a transmission, but we have some cases that allude to the fact that it might be. So we don't, the jury really isn't out on that, but I can tell you that it's very anxiety provoking for women to not know their status. So at Kapiolani, every C-section that's scheduled, every induction that's planned, if we know you're coming, then you get COVID testing 48 to 72 hours prior to your admission. If you're having surgery here at Kapiolani, any surgical patient that's admitted gets tested prior. And now we just, starting on Monday, every patient that is admitted to our healthcare or HPA system will get tested. We know that exposure takes some time to zero convert to know that someone's positive, but we do know that 48 to 72 hours is the window. So everyone that is admitted at Kapiolani will get tested. Once they're here in labor and delivery, they will undergo a testing process where we'll find out their status. And I think that that's an excellent move to reassuring our staff, reassuring healthcare workers, moms, everyone, that we are committed to making sure we know that their status. And that being said, everyone still treats every patient as if they are positive in a way that we're protecting the patient, we're protecting the staff, because we just don't know. And some of the tests are, as you know, are not perfect. So we're doing that at this point. And I think that that's a great move in the right direction. The other thing that has come to light is that pregnant moms are one of the highest asymptomatic carriers of COVID. And we've learned this. We know that population seems to be at risk for being silent carriers. So I think once patients learn that, and they've asked me about that, that is difficult to navigate. So I have a cough, and Dr. Pratt, do I have this? And so it's very difficult for moms to feel reassured that they're okay without getting a test. So universal testing has been something that my department has advocated for. The Department of Pediatrics is happy that this is happening. So they know the status of the mom. Not that we would lighten up our defense or we would do anything that would expose our staff, but we know status, and that has been very, very critical for how we care for patients at our facility. So that is a great thing. We're balancing that with supply, right? We only have so many tests. We only have so much, PPE, but we're trying to balance, and the pregnant women population is at risk. And at Kapiolani, we are dedicated to making sure that we protect our patients, our staff, and that is something that HPH has committed themselves to doing. So that's a great reassurance for moms that they're coming to a hospital that is safe. We'll try to know everybody's status. We are practicing multidisciplinary drills, nurses, doctors, all of us here at the facility. We practice, simulate what would happen if we had a positive COVID patient. We know exactly what we want to do, how we want to do it. We have protocols in place, and we've been anticipating this and hoping that it never happens. But we are prepared if that happens to make sure that patients are safe. And we all know that delivering in a hospital is the safest place to have your baby. There is no question about that. It is the safest place. Our task is to make it as natural and comfortable and as easy as possible to make it the most positive experience we possibly can.
I want to get into a little bit about the PPE. When this initial outbreak happened, the real talking point was that the hospitals throughout the country, and not only here locally, just weren't equipped, that there was obviously a shortage. And now that we're sort of in this time where obviously cases are down, that there is time to maybe plan for a potential second surge. Is that something that you folks in the hospital and in the healthcare industry are doing to sort of build a stockpile up? And how much of that do you build up, and how much are you anticipating in that in preparation for a potential second surge, and to face the realistic expectations of not having that?
Right, and that is a real bona fide question, and that has been the challenge. In the beginning, we were reaching out for all kinds of resources so that we can have that equipment. And I think that speaks to the other hat I wear, which is the Hawaii Medical Association hat, and working with the legislature and working with the healthcare associations and the hospitals and individual doctors to reach out for our resources. I can tell you that we are actively seeking PPE and making sure that we are well stocked and well supplied. I can reassure you that I really don't feel that that will be a problem, just because our state is very connected and we have a lot of resources and a lot of alliances throughout the world that I think that will not pose a problem for us. But we still need to be smart and not wasteful. And that's why in every use of an N95, a shield, every supply that we put on, we are very careful about how we use it, when we use it, and making sure we're not wasteful. But it has been a point of contention for a long time. And when did we implement that has been something that we've navigated in the past. Do we use that only in labor and delivery? Do we use that in the neonatal intensive care unit? Where are we using it? Where is appropriate? And the hospital has done HPH has done a very good job at looking at it on a national and international perspective to make sure we're making the right decisions for not only our women's and children's hospital, but system wide. So I'm very proud of what Hawaii Pacific Health has done in that arena.
We always get mask questions. We also got a lot of shout outs to you. I think there are a lot of your patients who are watching this morning. Lisa Vargas, Stella Yoshimura, we have Jocelyn, Val Kanuha. I just want to read these names because they're all saying how amazing you are, Sal, Misty. And the chorus goes on
everybody.
and on.
And I'm the blessed one. I'm the one that gets honored by being there at that special moment because I get to be in the room when it happens. So I'm very, very lucky.
We always get mask questions. Tessie has one, and actually this is one that I've been wondering too. Do you need to wear a mask under a face shield? The mask can feel so constricting when breathing, especially when you start to sweat under the mask. I've seen people just wearing a shield, but I've also seen people wearing both. So what are your thoughts on that? Because I think, we're all encouraged to wear the fabric mask, but now I see the shield. Also, I see some that are a hybrid of the two. What do you suggest?
Well, it depends on the setting. I mean, if you're talking about in the community, we all say fabric masks are sufficient. It depends on where we're talking. So if it's out and about in the community, then the fabric face shield has been deemed to be adequate. But I don't blame the public for wanting to be a little bit overprotective. And how far do you carry it? Well, actually, aerosolizing procedures, things like pushing in labor and delivery, or a newborn a child that's screaming, or someone who's shouting or yelling, you're going to be aerosolizing that droplet. And so that's where the risk comes in, and where eye shields have been important. If you're walking around in the grocery store and you're not confronted with someone who is exhibiting that kind of aerosolizing like behavior, then a fabric mask is fine. You don't need anything more than that. But when you're in a setting that requires someone who is, and more exposure to you, then a plastic shield would be more appropriate.
And a follow-up to that, Caroline Danielle says, is there such a thing as wearing a mask for too long and not getting enough oxygen? I think just physically, because it's Hawaii especially, people feel hot, right? Or you wear it in a weird way. I know my sunglasses will fog up. So you feel the urge to take it off, but can it inhibit your oxygen?
I would, if it's being worn properly, no, I don't think these fabric ones especially, it should not inhibit your ability to breathe normally and exchange oxygen. What we have learned is that, masks can cause, they call it maskitis, right? It's where, you get an allergic reaction to the mask, or you get acne from the mask. What I really learned about the fabric mask is to wash them. Because you think about when you purchase it, it's been fabric that has been pressed and probably starched. And, it's probably somewhat sanitary, but I've learned that the fabric masks that haven't been washed, the starch is really bothering people's faces and they're getting allergic reactions to that. And then just making sure you clean it properly and it's washed properly. Patients ask me all the time, should I not be wearing makeup? I mean, maybe I should just keep my face cleaner and change my mask more often. But any kind of skin issue that you're getting from your mask is probably due to the lengthy wear, which, we have to do. But it's also what is in the integrity of the mask itself. So it won't impede your ability to exchange oxygen. It won't, unless you're wearing it in an improper way. But a face fabric mask is sufficient for everyday community use. If you're in a healthcare arena, that's a different situation. And people ask me this question also about a kupuna. They're a little more at risk, right? And so do we gear up and gown up and mask and shield up for a kupuna? That is a question that, is determined by the health of that older patient and, if they have other healthcare morbidities. I can tell you in my practice, when this broke, I reached out to the kupunas that had their annuals due, those who were over 65 with the stay-at-home order, and we talked over the phone about their medical conditions and whether or not it was risky for them to venture out and whether they should. And it depended on their situation and what their medical conditions were and what they needed. Some of them I said, yes, you absolutely need to come in and we need to do all the preventative things to make sure that you're safe. And others, we decided to table that and trying to keep them safe. And they were afraid to come to the hospital initially. My office is in Kapiolani, so but fortunate for me, we're doing all the measures to make everyone safe, to keep it safe. But those are questions that we navigated, did telemedicine, talked over the phone a lot, and just tried to specifically address any kind of current situations that they had that were medically challenging, and then tabled their annuals. And at some point you couldn't get a mammogram, at some point you couldn't do these routine things. And so now, encouraging everyone to make sure you get what's preventative and what's needed, and that you put your health, first, but you also talk to your provider. Your doctor knows you best, can help you with those decisions.
Our time here is coming to an end. Just wanted to give you an opportunity maybe to say one last thing, maybe directly to those pregnant moms out there or anyone else, any women out there who may be watching. What would just your final word of encouragement or advice be for them during this time?
I would tell them that I'm very happy that they're carrying a healthy, beautiful baby in their belly, and that to enjoy this time and to frame your thinking around the fact that you're going to have a beautiful life that's going to be brought into this world. And 2020 is a challenging time, but more than ever, I've seen women rise and they're bringing it back home. They're being close to their partners and their family members. And it's a beautiful time. So keep it close and remember the joy of carrying that baby. I always said 9 months for you, lifetime for your baby. So enjoy the ride.
Thank you so much, Dr. Pratt. Always great to hear from you. Wonderful to hear your wisdom this morning. Thank you so much.
Thank you for having me.
Thank you.
Well, very good to hear from her, and interesting to hear that they are testing everyone who is admitted for COVID-19. And I think that kind of universal testing that she was talking about is really reassuring for patients, because if you need any kind of a procedure in the hospital, knowing that not just only you, but everyone else who's been admitted has also had that testing is wonderful to hear.
Yeah, and also interesting to note about just the asymptomatic numbers that she sort of spoke about with pregnant women. That's something that I had not known about either. So really great to hear different perspectives. Of course, we've heard from different doctors from Hawaii Pacific Health, each in their own sort of industry. And it's really interesting to hear how this pandemic has affected so many different sectors of the healthcare industry in so many different ways. And yet there is some overlining, similarities between all of them, but each of them having their own sort of unique complexities in relation to how they respond to the pandemic.
Yeah, and bottom line, wear a mask. It's not going to inhibit your oxygen, so we can all do that. And you're right, very important to know that pregnant women are a high number of asymptomatic carriers. Always good to hear from Dr. Pratt, and we appreciate her. We also want to talk about some other headlines in the news. This one is sure to be controversial. Public workers passing that first step to possibly getting a raise amid the pandemic. House and Senate negotiators basically passed that bill through. Now it will go to the full floor, but lawmakers saying privately that perhaps this is not going to be the right time to make that kind of an increase, given that so many people in the private sector have lost their jobs.
Yeah, definitely going to be one of those contentious issues. Of course, not only is the legislature having, of course, to deal with the pandemic and the sort of the state's response to that, but also these ongoing negotiations, these contract negotiations, as well as other issues that were already in front of the legislature prior to COVID-19. Everything's sort of been put on pause. And these negotiations are just one of the many that are happening. You know, we've seen it also in the private industry as well, with contract negotiations happening with various unions. And so the response now is, how do we handle dealing with sort of these contracts, as well as providing assistance of response to what is needed right now with so many people, of course, struggling throughout the state. So we'll continue to monitor that, and an opportunity to talk directly about that with Senate President Ron Kochi, who will be here on the program tomorrow. We're going to talk to him more, of course, about this issue, as well as other issues concerning the legislature and what their plan is to sort of provide more assistance and more support to residents during this time in COVID-19. We've heard a number of proposals come through. Going to be great to hear from him what he thinks is the most realistic approach to battling this, and what the leadership in both the House and Senate are looking at to sort of combat this. And we know as well that there have been cases of employees that have tested positive in the legislature for COVID-19. So how they're also managing that. We encourage you to tune in tomorrow to 10:30 again with Senate President Ron Kochi.
Yeah, some other big headlines today. A lot of people will be happy. Oahu City satellite city halls, 8 of the 9 will be reopening by appointment on July 1st. So those of you who need to get down to City Hall to do some business, that will be wonderful for many of you. Of course, you have to wear a mask, and it's by appointment only. The other thing that we want to alert you to is that state officials are warning about contact tracing scams. So if you get a text or a phone call saying that you may have been exposed to someone with COVID, that could be a legitimate contact tracer, or it could be someone who is trying to mine your information. We, of course, want to encourage you to talk to people who are doing legitimate contact tracing. That is so critical, of course, to containing the virus. So if you do get a call like that, do take it seriously, but be cautious in the kind of personal information that you reveal. Make sure that that person is from a legitimate medical outlet and not a scammer trying to get your social security number or some bank information.
Yeah, of course, to remind you that no tracer should ever be asking for any sort of payment or information about accounting services. So always just sort of use and proceed with caution when sort of dealing this. But again, Yanji, you're right. It's unfortunate that it's happening, especially to something that, of course, the state relies heavily on, especially during this time when we consider opening the state back up to travel. And those contract tracers will be so important into helping to navigate this time. So please be careful when going through that. Of course, we always like to end our show by highlighting some of the good things that are happening here in Hawaii through our Hawaii Hero segment. And today we have another hero right here, down to earth, continuing to do good in our community.
That's right. They partnered with the Hawaii Food Bank. They hosted an Aloha for Our Neighbors drive on June 12th and June 19th. Down to Earth matched all donations. And so the Natural Health Food Store arranged for all donations to be delivered to the food bank. Wonderful to see Down to Earth supporting Hawaii Food Bank. We really love to see all of our community partners getting together and doing good for that important organization. So mahalo to Down to Earth, mahalo, of course, to the Hawaii Food Bank. They've gotten rid of those large drives at Aloha Stadium, but they are still doing deliveries at dozens of sites throughout the state of Hawaii. So if you need any assistance, you can always head over to their website and find out where you can find food distribution.
That's right. And of course, we want to thank them as well as all the many people and organizations that are continuing to do great things in our community. We will continue on in this conversation. Again, we talked about Senate President Ron Kochi being here tomorrow. We will also be speaking to Lieutenant Governor Josh Green on Friday. And again, we know that the governor is set to have a press conference this afternoon. And so a lot of people are pointing to the fact that he will make some sort of announcement about the opening of Hawaii to out-of-state travelers. Again, we do not know specifically what he's going to announce, but we have heard that it will require or really detail something about getting tests prior to coming. There are also some talks that are saying that the state will not actually do in-state testing for those who arrive because the state just does not have enough testing capacity for that. So we will expect to get more details hopefully this afternoon and speak directly with the Lieutenant Governor, who we know has been working directly on this issue. Again, he will be here on Thursday to sort of navigate us through that conversation. And then on Monday, we'll be back with the governor to do a follow-up on that as well. And then on Tuesday will be sort of our last show in this COVID-19 care conversation, which has been sort of a wild ride, so to speak. We started this months ago, never thought we would continue to be here, but it's been a great conversation, and we thank everybody for being a part of it.
That's right. And it's not going away entirely. The week of July 6th, we launch a sort of a variation on the theme. We are going to be continuing the conversation, but it won't focus exclusively on COVID. We're going to be meeting here on Mondays and Wednesdays at 10:30 in the morning. We're super excited because we're going to be kicking off this new conversation, if you will, with the Honolulu mayoral candidates one at a time. We've worked with the editorial board. There's 15 folks who signed up to run for that office. We unfortunately can't have all 15, but we've winnowed down to 6 candidates. So we're going to be doing 2 per week in the first 3 weeks of July, having extended one-on-one conversations. And we're so excited to have you be able to interact with these candidates directly. I mean, Ryan, campaigning has changed so much because of COVID. It used to be that you could, go to maybe a Rotary Club or a high school or somebody who was hosting one of these candidates, meet them in person. The coffee with the candidates have become so ubiquitous in this sort of time ahead of an election. That's not going to be here. So we're going to host you with them. You can bring a cup of coffee and type in your questions, and we're really looking forward to that conversation. That's
right. No chili and rice dinners with candidates this election cycle. And so really it's our opportunity to help to provide you, the viewers, the Honolulu Star-Advertiser information and getting you further in-depth content on where these candidates stand on some key issues, including COVID-19 and how the new mayor will sort of battle this. This is going to be a difficult time for whoever's in this seat. They're going to sort of be thrusted into some budget shortfall issues, as well as managing the response to COVID-19, not only in the near future, but for the foreseeable future, and how this city reacts to that. So we're looking forward to that. And of course, we want to thank our sponsors of this program, of course, Hawaii Executive Collaborative and Hawaii Pacific Health, for allowing us the opportunity to continue this conversation for as long as we have. And again, we thank all of you, our viewers. Again, we are not done yet. We have a few more episodes left, starting tomorrow with, of course, Senate President Ron Kochi, that we are excited to see all of you right back here at 10:30 tomorrow on the COVID-19 care conversation. Until then, aloha.
See you then.